So good morning, everyone. My name is Jane Kim, and I hail from a small town in California, San Francisco, where I serve on the Board of Supervisors. And I'm really proud to be part of a city which pioneered Healthy San Francisco, a program which launched in 2007 to provide subsidized medical insurance for uninsured residents in San Francisco, regardless of citizenship and documentation. We are the first city to attempt to provide health insurance for all of our residents, and in fact, over 90% of our uninsured residents are now a part of our Healthy San Francisco program. So you all know, but according to a June 2018 poll, 63% of Americans support some type of national health insurance plan, also known as Medicare for All, a program under which the federal government would guarantee health insurance for everyone in this country. But how do you make this happen? So I am proud to introduce the panel that is before us today. I'd like to introduce our first panelist. And by the way, if you have a friend who just doesn't get Medicare for All, or thinks it's a pipe dream that can only occur in the idyllic Canada or Europe, and doesn't think that it can happen here or it's too expensive, have them read one of Diane Archer's pieces, the president of Just Care USA. Diane can break down this incredibly complex policy into a way that you can understand clearly what it would look like, what it will cost, and what it will save for our nation. So please give it up for Diane. Our second panelist is Joe Beardsmore, the senior advisor at Social Practice, who facilitates collaboration in campaigns including Medicare for All in this country, working with the National Nurses United. Joe works to use organizing and direct action to disrupt government narratives around the status quo. Our next speaker is a doctor working to expand healthcare access, in particular to asylum seekers and other vulnerable populations, is a mother, a first-generation immigrant, and yes, this is literally what is in her bio, quote, in her spare time is a city councilor and campaigns to create a greater platform for addressing inequity in Oxfordshire, and is a Labour Party member, Dr. Hosnia Defari Marbini. Our next speaker and also a moderator are both part of the heroic National Nurses Union, Kelly Coogan-Gare, who will moderate today's panel, and Libby Devlin, both serving as directors on the Medicare for All campaign that we are also excited to be a part of here in this country. I just have to give a quick shout out before I introduce our opening speaker to the nurses. For those of you that have worked for a long time in organizing here in this country, you'll know that labor predominantly looks one way, but the California nurses, both their leadership and their member organizers, are primarily women, and fearless, kick-ass women at that. When I started as a youth community organizer in San Francisco, I was part of a collaborative of labor and community-based organizations that was brought together to put together a united progressive agenda in San Francisco. And in that year, in 2005, we were endorsing ballot measures, and there was one around campaign finance reform. And there was only one labor union that was brave and courageous enough to stand for the state ballot measures, and it was the California nurses. And in that year, they were also the first labor union to challenge then the new governor, Arnold Schwarzenegger, when many other unions were afraid to because they wanted to have a good relationship, of course, with our highest official at the state. But they took on the governor, staging more than 100 protests in 12 months, advocating for fringe political ideas like public financing in campaigns and Medicare for All. It was 10 years later when I walked into their office for an endorsement, and I remember seeing stacks of Bernie Sanders for president style signs stockpiled throughout this union. And by the way, at this time in 2015, Bernie was still a kind of out there fringe senator from the state of Vermont that was maybe going to get single-digit or teen percentages of votes in primaries across the country, but the nurses had early endorsed him. And I remember thinking, wow, these are some crazy badass nurses. Well, we saw how that eventually went, and now we're seeing that these fringe political ideas have now become mainstreamed in large part to the work and the leadership of the nurses. And reflecting on Simon's comments last night, they truly are infinite game players. They understand the long-term game and investing in ideas and making sure that we can bring it to reality.